A very warm welcome and good evening to all those who could make it today evening. On behalf of the Leadership Development Subcommittee of the Psychiatry Society Western Zonal Branch. As we all know, leaders are people who help us transform our limitations into possibilities. And today we start our first webinar with the aim to learn leadership skills from one of an eminent psychiatrist amongst us, Dr. Shiv Gautam sir. To flag off the program, may I now invite our president, Dr. Sudhir Bhave sir, to share a few words of wisdom.
Yeah, thanks a lot, Abha. It's wonderful to be here in this seminar. I think at the outset, I must say that under Dr. Deepak Rathod, this committee has already started doing great work. Just 2 days back, he had a physical program in Amravati, which I had the privilege to attend. And Deepak, I must say that you surpassed my expectations. I think this was the first seminar on leadership of yours that I heard. And I mean, your mastery on the subject and all the details that you could expand upon, I think that was truly impressive. And it's a pleasant surprise that only within 2 days, he has again organized an online meeting. And I think Dr. Shiv Gautam being here is a huge privilege. Dr. Shiv Gautam, I think more would be told about him later, but he is an iconic figure in the field of psychiatry in Nagpur. And if I recall correctly, Dr. Shiv Gautam, sir, you were president of IPS in 1999. Is that right?
Yes, he was president.
Yeah. And you were perhaps the youngest IPS president ever?
Yes, at the age of 48.
I recall I had attended that conference, and I mean, it was that was put on record that he's the youngest IPS president ever. I have a very special personal relationship with Dr. Gautam, and I would like to tell the audience here that this program, Talents of IPS, that we have every year, was in fact entirely his brainchild. And he started that program with me in 2010, if I'm not wrong. So that's 15 years back. And it was all because of his encouragement and I mean, his vision, which I don't know how he had it, but he thought that I'll be perhaps a good person to lead it. So we are 15 years into that. So basically what I'm trying to say is that he has done many big things in IPS. He has been holding these conferences frequently in Jaipur for the IPS guidelines, clinical practice guidelines. And I mean, we all know much about him. So I think it's a great, I mean, it's a casting coup. Deepak Rathod has managed to rope him in today. I think perhaps none better than him to espouse on leadership and in organizations and so on. And a pleasant surprise or a pleasant addition to the program is, of course, talk by Dr. Deepak Rathod also on a topic of his choice after Dr. Shiv Gautam's interview by Abha is over. So I welcome you all, and I'm certain, I don't have to say wish you a great listening, but I'm sure that you are going to have a great listening. Thank you all.
Thank you so much, sir. Thank you so much for encouraging us and giving us a brief outline of the program. May I now take this opportunity to introduce the chairperson for today's program, Dr. Vijay Nagecha, sir. As we all know, sir is the advisor for our committee. He's a consultant psychiatrist at Nagecha Hospital, Rajkot. Sir has been an ex-assistant professor at the Rajkot Medical College. He is attached to multiple other centers like the Civil Hospital Rajkot and has been the founder psychiatrist at the Addiction Center at Veernagar. He has held multiple posts at various national level as well as local level psychiatry organizations, including the IAPP, IPS, Western Zonal Branch, and as well as the Indian Psychiatry Society. He has been the founder president of the Rajkot Psychiatry Club and is currently the president of the Saurashtra Kutch Psychiatry Society. It is our honor, sir, to have you chair this session for today. And may I now request sir to say a few words of wisdom before he introduces our speaker for the day.
Thank you, Abha, for giving a good introduction. Dr. Sudhir Bhave has only highlighted all the things about the Dr. Shiv Gautam. And the best thing is when we talk about the leadership program, I don't feel that there is no other than Dr. Shiv Gautam who would really highlight it in the guide. Basically, the leader is the who would guide the juniors to tell something, and they become the pathfinder of the pathfinder for the juniors and for the other persons, so that the junior can act and learn something from that. There are certain leaders who are really a born leader. One of the born leader I could find is Dr. Shiv Gautam. I'll give you one incident. When I was studying in the second year of a psychiatry in Baroda Medical College, I had attended one World Psychiatric Conference which was held by at Jaipur, and the organizing secretary of Dr. Shiv Gautam. That time, what happened that we don't have anything to stay, and then I just requested Dr. Shiv Gautam that please arrange something for us. And immediately he gave me an address that you go this place and everything will be taken care. So such kind of a person who is very helping in nature, the first and foremost leadership quality, that the person should be very approachable, give the proper guidance, give the perfect thing, and the act on a time. That is the best quality of the leader. And for the mental health and the psychiatric illness, if you think about the leader, then they are resilient toward the everything, because every day we had a kind of a thing which comes across patient's pressure, patient's relatives pressure, and our own certain kind of problems that leads to a multiple problem. And the like Dr. Shiv Gautam, who had a person who can give a immediate solution to such kind of a problem. This is regarding Dr. Shiv Gautam. If I think about his biodata or the thing, he is a director of the Gautam Institute of Behavioral Science and Alternative Medicine. He was the president of Mental Health Foundation in Jaipur. He was advisor for the Social Justice and Empowerment Government of India 2018. He was a member of Advisory Board of Health National Human Rights Commission, New Delhi, advisory at Rajasthan State Human Commission, president of Indian Psychiatric Society, additional principal is SMS Medical College, Jaipur, senior professor, HOD, superintendent of the Psychiatric Center, Jaipur, member board of the Secondary Education Ajmer, member of Medical Council of India, member of Secretary of Rajasthan. There are innumerable things, and he has many awards and honors in his basket. This is Bhagwat Award, PPP Award, Tilak Venkobara Award, International New Horizon Award, Marfati Award, Fellowship National Award. So he is a tremendous personality. So we'd like to hear from him what exactly the leader should behave, and which are the things giving a tip that how leaders should act in a certain situation. Over to Abha.
Thank you so much, sir, for that introduction. May I now invite Dr. Amar Shinde, sir, as my co-moderator for the session, along with, of course, Dr. Shiv Gautam, sir, whom we are all very eager to hear from. And I will, both Dr. Amar, sir, and me would have the honor of interviewing our eminent leader for the day, Dr. Shiv Gautam, sir.
Yes, thank you, Abha. And what a wonderful introduction. And it looks like Dr. Shiv Gautam is born leader. So I think he has done leadership in IPS, in the private, everywhere almost he has done very well. So I would like to ask him one question. The first question, what are your strengths and weaknesses in leadership?
Well, at the outset, can you hear me?
Yes, sir.
Yes, sir.
At the outset, I would like to thank the West Zone of Indian Psychiatric Society for considering me an eligible person. I don't know whether I am for this particular opening session of the Leadership Development Program. Well, I was youngest president of Indian Psychiatric Society till date at the age of 48 years. And I would say my strength came from my teachers. When I used to see Dr. R.L. Kapoor, Dr. Venkobara, Dr. Neki, Dr. Vig from Chandigarh, all these people, when I was studying at Nimhans, they were all my inspiration. And I used to feel, because I am basically a rural boy who studied in a Hindi medium school in a very small village and hardly knew how to talk in English when entered the medical college. So when at that point in time when I was doing psychiatry, I used to look at all these big stalwarts of Indian psychiatry and used to get a lot of inspiration from them. So the inspiration and the teaching of the teachers, I think, was first strength which I had. The second strength, when I entered the medical college, I was, of course, a Hindi debater. But then, when I was not able to converse so well in English, I had a feeling that I should communicate in English. And I learned practically English speaking, and I became the best debater of my college, and I represented my college in the university and University of Rajasthan in the inter-university debate.
Great.
Won the trophy for my medical college. So that gave me tremendous strength to feel that I can do it. So a feeling and feeling confident in yourself is one of the biggest strength I feel. And the mantra is, I can do it. That is one thing. Second strength which I consider is my communication skill. I am able to communicate to the rural people. I can communicate to my undergraduate students. I can communicate to the postgraduate students. And I have communicated to people all over the world. I have traveled so far 3/4 of the globe through my lectures. And I consider that the communication skill which I have is an important strength which I have, and which has not come out of my formal education, but it has come out of the informal learning from friends like you. And I think I'm still learning when I am talking to young lady Ava. Are you Dr. Bang's daughter, Ava?
Yes, sir. Yes, sir. Yes, sir.
Dr. Bang was a good friend of mine.
Yes,
And when
sir.
I heard Ava Bang, then I thought, she is my daughter, she is my friend's daughter.
Thank you
And
so much.
that is how I communicate to people. And I have a one-to-one relationship when I communicate with them.
So
Another strength which I feel is very important is my passion for my work. And I enjoy my work a lot. Believe me, people who consider work as burden and people who consider work as enjoyment, there is a lot of difference. And my strength is I enjoy my work every moment, whether I'm writing, whether I'm reading, whether I'm lecturing, whether I'm communicating with my patients, or I'm communicating with people. I have talked to large number of gatherings by now. In Jaipur, we have an organization called Mental Health Foundation, which is my baby. And through this organization, I have so far covered about 60,000 students who are not medical students, but they are students of class 9, 10, 11, and 12 in the schools. And communicating with these people gives me a lot of pleasure because it is my passion. And I teach them mental health, how to say no to drugs, how to develop their personality, how to have creativity, and how they can succeed in life. So that is another strength I feel I have, that my ability to communicate with people at various levels, including grassroots villagers to the professionals nationally and internationally. The third strength which I consider is my friends. I have few close friends who keep inspiring me. And every time, whenever I do a small thing and when it comes to their notice, Gautam, this was wonderful. And that encouragement is my strength. And I owe to these friends. Some of them are maybe present even now in this webinar, who asked me that please send us the link. So I'm grateful to them. Then another strength which I think I have is my ability to introspect. I can introspect in myself, I can learn my weaknesses, and from the weaknesses, I overcome them and I become more strong. I consider that my critics are my best strength, because people who have, of course, I have had very few critics in my career. As a secretary of the South Zone to the Indian Psychiatric Society, as secretary of the Rajasthan Psychiatric Society, president of the Rajasthan Psychiatric Society, president of North Zone of Indian Psychiatric Society, honorary general secretary of Indian Psychiatric Society before Dr. Bang, and vice president and president-elect of Indian Psychiatric Society and president of Indian Psychiatric Society. It is a record that I have always been unanimous. None of the friends contested against me, and they said, Gautam, you are contesting, so I am withdrawing. And I remember my dear friend, Dr. K.A. Kumar, who became president after me. Dr. G.C. Carr, late Dr. G.C. Carr, we lost him few weeks ago. Both of them were contestant, and when I called them, are you contesting against me? They said, no. If you are there, we are not there. So my strength is that being unanimous all through in Indian Psychiatric Society in my career was because of my friends, and they were my strength. My critics in my department, when I was heading the Department of Psychiatry in the medical college, later I became the additional principal of the SMS Medical College. People used to come and tell me that this so-and-so person is your critic. I used to call him and include him or her in one of the important committees of the hospital. And I used to tell them that, look, you are the one who is going to take the decision. And when your critic is a part of your decision, there would be nobody to criticize you. That has always been my policy, and I have enjoyed being friend of my critics. And later on, all my critics became my best friends. So I think it is very important to have critics. In Rajasthan, we have a kind of saying, निंदक नीडे राखिए. जो आपकी निंदा करता है उसको आपको नजदीक रखना चाहिए. And he washes you like soap, and he makes you, so that is how this. Then another important strength I have is my family. My wife, Rajeshri, she is one of those critics who helps me to grow. Believe me, every time, every small mistake I make, socially, personally, or anywhere, she is the one who reminds me that, look, here you have gone wrong. And I correct myself. My son, Manasvi, you know all of them. All of you know him. He is now a member of the Central Council. He also has now joined us, and he and his wife, Anita, both are strength in the hospital. So these are some of the strengths: my passion to work, enjoying my work, my communication skills, my critics, and my introspection. This I consider as my strength.
Thank you so much, sir, for that holistic answer. And I'm sure all of us can learn a little bit about focusing on our strengths about that. If I may ask, what past events most influenced your leadership approach? The way you approach leadership, is there any particular past event that made you change your approach or define the way you approach leadership?
Well, if I recall my life, when I was a student at Nimhans, Can you hear me? I'm getting a written script on my computer that I need to improve the performance. Low system resource. Can you hear me?
Yeah.
Sir, you're audible.
Okay. One of the things which made me very confident. See, when I was a student of MD, I distinctly recall that those days we did not have PowerPoint presentations. We had to struggle a lot to make transparencies. And most of the seminars which we were presenting, they were written script which we used to read in front of about 40 to 80 people who are present in the seminar. One day when I had prepared my seminar on generalized anxiety disorder, I remember distinctly. And Dr. Kapoor was my head of the department. So I was coming down from my flat. My wife called me for some reason. I kept the file on the boundary wall wherein my seminar was contained. And I went upstairs and talked with her and I came out. By the time I reached downstairs, I find that one cow was eating that file, which was 2 weeks of my labor in the library. And that file was being swallowed in front of me by the cow, and I could not snatch it out. And I got so nervous. How am I going to present the seminar? So I went to Dr. Kapoor. I told him, sir, I cannot present the seminar. He said, what happened? I narrated him the entire thing and he started laughing. My God, तुम्हारी seminar को कुछ गाय खा गई? And I said, sir, this is what happened. So I cannot present it now. I had worked very hard for it. He said, you will present it. I said, how? He said, you go to the library. You have all the books in front of you. Just take down the pointers, write them down on a piece of paper, and you present it.
Hello.
And that was the first extempore seminar which I had presented at Nimhans. And believe me, it went so well that I was so grateful to Dr. Kapoor that after that, I never read a written seminar or a written paper. All my presentations were by bullet dots, pointers. So this was one event which made me a very confident speaker. Another event I distinctly remember was the Mumbai conference of Indian Psychiatric Society, where I was a very young assistant professor. And one of the eminent psychiatrists of the country made his presentation. I would not name him, he is no more. And I asked him a question, which was an embarrassing question to him. So all people started looking at me, who is this boy? Who is asking this question to such a learned, eminent speaker of Indian Psychiatric Society? Anyway, it went on. The speaker could not answer and I made the answer correct. And after that, some senior people from the Indian Psychiatric Society, they called me. Young boy, come here. Who are you? Where are you from? And that is how I became known to many senior people. So the advice I would like to give to young people is never hesitate to ask a question to a very senior person also, if you feel you have a doubt in that. And that event also turned my life. Another event which I recall, was the Varanasi Conference of Indian Psychiatric Society. I was contesting election for direct member. And somehow in the medical college where I was working, I was supposed to be one of the organizers for the 4-decade function of the medical college. The college was completing 4 decades of its existence. Now it is 7 decades, 30 years back. 35 years back. I did not know what to do. I am contesting election for the direct council member of Indian Psychiatric Society. So I wrote 5 letters to my 5 friends from different zones that, look, under these circumstances, I am not able to come. And can you look after my election to the Indian Psychiatric Society as a direct council member? And it was such a pleasant thing to happen that I was elected with maximum votes. So a person getting elected in an election in his absence because of his friends like Dr. Jhanwar, many others were there. And I recall it that this is how your friends are your strength. This is another event which I recall. Well, there are many events which can be recalled, but I don't know how much time Abha has given to me. So can you go to the next question?
Yes, yes, sir. It was very interesting things you have already informed us. So we would like to know what are the turning points or critical points in your life till now.
Well, I think I have never turned back.
That's good.
So it has always been turning forward. And one turning point was my admission to the medical college. Reason being that I was, as a student of those days, it used to be 3-year degree course, and I was in first year of degree course after my 11th. So I was selected in the National Cadet Corps as an under officer. And I was commanding that NCC unit. And I was selected as a lieutenant for the army at that point in time. And if I joined there, then I would immediately start getting salary of a second lieutenant in the NCC itself. So I told my father that I have been selected for this wonderful thing and I want to go to army. My father was an Ayurvedic physician and he wanted me to be a doctor. So he said, no, you have to go to medical college and don't accept this invitation for the army. If I had joined then, probably I would have retired as some lieutenant general or something by now. But he asked me not to go in the army and join the medical school. And I joined SMS Medical College. So that was a turning point in life in the early career. Then coming to psychiatry was another turning point. Because I had joined psychiatry by choice. Because in our days, psychiatry was a discipline which was normally taken over by people who were left over after taking pediatrics, general medicine, surgery. Medicine was the first choice. So when I went in front of the interview board, the principal of the medical college, he knew me well. And he said, what is your choice? All specialties were open. I said, sir, psychiatry. He said, क्या शिव पागल हो गए क्या? तुम psychiatry join करना चाहते हो? I said, yes, sir. He said, no, you are getting medicine. You are getting surgery. You are getting all the disciplines available. Why do you want to go to psychiatry? I did not answer him at that point in time. He turned me out of the interview room. The faculty adjourned for a cup of tea and they said, we'll call you after 10 minutes. You come back and let us know. After 10 minutes, I was called again. What is your choice now? Tell me. I said, sir, still psychiatry. And that still psychiatry was with so much of confidence that he said, okay, I will not rotate you to medicine later. You give it to me in writing. I said, sir, I have decided. I will go to All India Institute of Mental Health then, which is now NIMHANS. because Nimhans was, I was first batch, because I joined DPM in All India Institute of Mental Health, and I came out of National Institute of Mental Health and Neurosciences. It amalgamated then in the year 1975-76. I said, sir, I'll go there and I can give it to you in writing. I will not join medicine. And I took a stand and I joined psychiatry. And I think it was a big turning point, because my choice of psychiatry has made me what I am today, and why I am being interviewed by all of you now. After joining psychiatry, I think it has been a smooth journey all through. So I cannot recall of a turning point.
Thank you, sir. And that really leads me on to the next question, because you spoke about psychiatry being the pivotal point that turned your life around. So, do you think, as psychiatrist, the practice of psychiatry, the knowledge of psychiatry, helps us become better leaders, or can sometimes become an obstacle for us as a leader? So, what's the pros and cons of being a psychiatrist in a leadership mode?
I think psychiatrist has to be a leader. Every psychiatrist has to be a leader, because he has to lead his team of the mental health professionals, number one. Number two, the stigma prevalent in the society is so much that to remove that stigma, if you do not take leadership role, the stigma will not go away. I distinctly recall in the year 1979-80, when I joined as assistant professor in the SMS Medical College. Here we have practicing posts. We can work in the government hospital, and evening we could practice at our home. So some of the so-called elite people of the society, when they used to take an appointment from me, they would always say, Dr. Gautam, we want to see you late in the evening around 8 o'clock. I said, why? Because that suits us. Then they would park their car about 200 meters away from my house, come to my house for consultation, as if they are going for some kind of criminal work, look around that we are not being seen by anybody, and quietly come, and then would request at the end of it, please don't tell anyone that we have come here for consultation. That was the state of stigma then. And when I started the community psychiatry movement in Rajasthan, which I had learned from my teachers like Dr. Vig and Dr. Kapoor, the stigma now has almost gone. And in my hospital, outside my consultation chamber, there is a queue of more than 100 people. And out of these 100 to 150 people, there are people from all walks of life, rural and urban, rich and poor, elite and middle class people. And no one feels that he is stigma-ridden. They feel as if it is a normal thing. So a psychiatrist has to take a leadership role, because, but still, stigma remains in some parts of the world even now. So if we have to fight this stigma, we have to take a leadership role. We have to teach people. We have to communicate with the society at large. And this, I think, has to be done. Psychiatrist as a leader can provide better leadership because of his communication skills, because of his ability to understand people, because of his empathy he has towards people. And when you are as a leader, you have to be empathetic towards your colleagues, your juniors, and all people who are helping you out. And you have to know the needs of the people who are with you, what kind of empowerment they require. Look at that and then provide them that need, fulfill that need, so that you become an effective leader.
Yeah, great. Thank you, sir. And I think So we'll come to the next regarding the IPS. You have done a
Yes,
lot work, and you are the youngest IPS president. And also, Rajasthan has contributed too much for the IPS. They have developed the our building, IPS building, and Rajasthan is the biggest contributor.
well, that is a humble contribution of Rajasthan.
Yes,
We
yes, it's
provided
one.
national headquarters to the Indian Psychiatric Society, and some of the senior people like Sudhir, Dr. Deepak, and Dr. Nagecha, they would remember how in
Hmm.
the Jan it came.
Yeah, yeah, I personally visited the place once, so I read there. Also, what is your vision for IPS for our new leaders, and what should they do, and how IPS should progress? That is our next question.
See, one good thing which has happened in IPS is providing leadership to the SAARC countries. This is a very, very important move which has happened in Indian psychiatry. We Indian psychiatrists are considered to be leaders in the SAARC countries. I think in the Southeast Asia also, Indian psychiatry has to provide a leadership. And ultimately, when we look at the heritage of India, I think we are bound to be world leaders. I distinctly remember that in 1989, when I gave my address in the Madrid World Congress in Madrid, the topic was Indian ancient. What is contribution of Indian ancient to the Western psychiatry? And the concluding remark by the professor who was chairing from the Germany University, he said what comes out of the talk from Dr. Shiv Gautam is what is recent for us is ancient for India. So we have our ancient heritage. We have a lot of material which is unexplored, and that unexplored material has to be re-explored for the benefit of the world psychiatry. And I think that is the responsibility of people from Indian psychiatry. I have been continuously, probably the longest chair of the clinical practice guidelines of Indian psychiatry. Probably my committee is the only committee which has served for more than 2 decades, 21 consecutive years. And we have brought 15 volumes of clinical practice guidelines, which are in hands of everybody, all psychiatrists of the country. I have covered almost all facets of psychiatry, including the spiritual aspects, including the psychotherapy, what kind of psychotherapy should be in India, what kind of research should be in spiritual field, and how we can communicate to Western world using our anecdotes as well as how we can use modern scientific research to establish our methods of treatment which are more suited for this culture in comparison to the Western culture. Some of the things which I think we have to provide leadership to SAARC, to the Southeast Asia, and some of the developments like what we have Indo-Global Psychiatric Initiative. Recently, we had the conference of the IGPI, Indo-Global Psychiatric Initiative in Hyderabad, just before the NSIPS this year. And there were people from Indian origin, psychiatrists of Indian origin, who are doing very well in Western countries like the British Indian Psychiatric Association, Indo-American Psychiatric Association, Indo-Australian Psychiatric Association. And all these people were there, and also people from the SAARC countries were there. And this Indo-Global Psychiatric Initiative is an important initiative which Indian psychiatry has taken up. And I wish that all of you who are listening to me should go for leadership, not only in this country, but leadership to the rest of the world as well.
So that gets us to the concluding question we have for today's exciting and inspiring interview that we are so far listening to. So, what would be that one piece of advice that you would like to pass on to the younger generation, like myself and Dr. Amar sir and everyone else, to fulfill the vision that you've just shared with us about going global and not just thinking of local level, but local as well as global? So, what is that one piece of advice that we should carry?
First advice is don't be in hurry. Rome was not built in a day. So you have to wait. And don't be disheartened if you do not get things at first attempt. Okay. Second piece of advice which I would like to give is be consistent in your steps. You have vision for immediate goals. You have vision for goals ahead, and you have to have vision for the final goal where you want to reach. So it should not be just an immediate gain. Immediate gain, if you think of, you cannot go for the future goal, which is long ahead. So have all the three goals in your mind. Go ahead and have determination. It is bound to happen.
Thank you. Thank you so much, sir. That is definitely something very crisp, precise, and to the point. Thank you so much, sir. There is a bunch of questions from the audience that they also want to ask, but we will take them after Dr. Rathod sir's session, if you're okay with that. Yeah. May I now request Dr. Amar sir to introduce our next speaker who's going to follow this great interview that we've just had, that I'm still processing all the words that he has just shared with us. And for that, may I request Dr. Amar sir to please introduce our speaker. Yeah.
So today's our second speaker. Everybody know Dr. Deepak Rathod. He is very much interested in this leadership programs, and he's a psychiatrist and corporate trainer. Also, he is practicing in Sahyadri Neuroscience Institute of Mental Health, Kalyan, Mumbai. Also, he is a regulatory member of RKS Mental Hospital, Thane. Accredited faculty of Maharashtra Medical Council. Also, visiting faculty and HR Birla College, Kalyan. He is chairman of IPS Leadership Development, IIPP Leadership Development, and chair of IPS West Zone Leadership Development. And he was president IPS West Zone Gujarat Maharashtra Goa in 2019. Also organizing chair of Golden Conference of IPS West Zone 2019. He is a ex-chair IPS National Task Force for Training and organizing chair for IMA Mega CME in Kalyan 2012. Also organizing secretary IPS Zonal CME Alibag in 2009. He is also founder secretary for and trustee at ex-president IPS Thane, Indian Psychiatric Society Thane, founder and president and trustee at Ambernath Medical Association. He is having lot of community work, like more than 300 workshop for teacher, parent, student, from government and corporate as well since 1988. State award for de-addiction awareness from Maharashtra State Social Welfare Department 1999 to 4. Also ex-judge for Maharashtra State Competition for De-addiction Initiative in 2004. He designed organizational model for ordinance factories and also associated since 1994 with Aadhaar biggest rehab facility for differently able persons and recipient of National Trust Award by RCI. So we will hear from great Dr. Deepak Rathod about his leadership thinking, how to go about, and he is bound to develop a lot of leaders in our Indian Psychiatric Society. Thank you, sir. Please proceed.
Thank you, Amar. Thank you so much. Actually, just the day before yesterday, we conducted a 4-hour workshop at Amravati, and the response was very, very good. Dr. Bhave sir, I call him Sudhir Bhau. He was there to bless us, grace us. Dr. Rathi was also there, and it was a very pleasant meeting. All my friends from Vidarbha, and directly jumping to the topic of today's discussion. It is a small topic. Actually, these theories, they take complete day. If we discuss in very long, it will take long, multiple cases. Most of the management training is through cases. Theory, our professors would just give us assignment, and they would say, "Abhi 15 minute आप बात करो, आ जाओ stage के ऊपर." And so there was practically no teaching at time, teaching, and the professor would sit beside us or on the last bench. So we are taking this topic in a very short way, and I will try to make it very crisp and give an outline. So sir was talking about relationships. Abha is Bang sir's daughter, and Bang sir was my elder brother. So I always called him Dada. And Abha's mother, I always call Vahini. So that relationship is always there. So Dr. Sudhir, I call Bhau. So that relationship we are talking today, and how this relationship can unfold into magic when we take the perspective of as a leader. I come from a rural area, practically a tribal area, lived in a mud house, no facilities, no amenities, practically not electricity, no other facilities you can say. But then we were very neatly, very clean, and then environment were very nice, homely, and we were very tight bound communities. We were all very close. So that childhood memories still I cherish. How was that life, that wonderful life? I still miss many times. When I had been to Raipur conference, I asked the organizer to मुझे मेरा जन्म स्थान पे मुझे लेके चले. So I went to Bilaspur. I saw my place, birthplace there, and I was ऐसा लगा मुझे कि तीर्थ मुझे मिल गया, तीर्थ क्षेत्र में जाके आ गया. So like that is how relations are. So I will share my slides immediately. Yeah. Now open this. I can open this. Are you sure? Yeah. Is it visible now? Hello.
I
No,
can
sir,
see, sir, you have to share the slides.
Yes, sir, you haven't done screen sharing, sir.
Hmm?
Open Zoom. Open Zoom. If you can, sir, or else if you can just send me those PPTs, I can share them through my screen if they're not getting shared.
Come this side.
My granddaughter helps me the same way as your daughter is helping you.
I think it should be visible.
Yeah. Is something visible now?
Yes, yes.
Yes, sir.
Leadership
Yes, sir.
stories.
Yes, sir.
We
Yes.
can see the 10-point slide.
Yeah.
Yeah. Okay. So actually, our workshop, it deals. There are 10 theories of leadership. If there are multiple, then 10 important theories, and 9th of that is relations. This is called as LMX theory, or it is a short form for leader-member exchange. The word itself can be explained like that. There is an exchange of relationship, sometimes even at the emotional level, between the member and the leader. So leadership process is centered on the interactions between leader and the follower. It is a dyadic relationship between leader and follower. That is the focal point of this leadership. So in howsoever big a leader may become, he has some relationship with his members. So one leader can have relationship with many members or followers, but the quality of that leader relationship will change. Some will have very strong relationship, some will have little bit weaker relationship. So that we call as LMX. We can say strong LMX or little bit weaker LMX. Relationship based approach. On one side, I have shown that follower, and another side is leader. And in between, there is the dyadic relationship. Earlier, the concept was that relationship was defined in terms of vertical dyad linkages. That there is relationship, one-to-one relationship between the leader and the follower. Later on, it was found that these relationships are clubbed under certain groups. The first is in group and the second is out group. So in group and out group members, we can divide member into in group members and out group members. So in group members are closer to the leader, and among the in group members also, they are closer to each other. And then there are other people who can be called as out group people, and their relationship with the organization and the leader is more of a formal type or formal employment type. And in-group members take on extra roles and responsibilities which are not written on the job profile. They are based on their how much work they take. Personality also plays a lot of role here. And these followers are ready to expand their role responsibilities when asked for. They negotiate with the leader and ask for important and any emergency or hard work. They can negotiate. And the negotiations are the exchange beyond their formal role. And those who are not interested in doing that work or not interested in taking up very interesting and hard work, they can be pushed automatically to the out group. In group members, they receive more information from leader. In group members, they have more influence over the complete group. In group members have more confidence, and they have more concern for the group and the organization. And they receive more concern from the leader also. In-group members are more dependable, involved, and communicative. That's why they get more work also, and the leader relies more on them. And the relationship is marked by mutual trust, respect, and liking. And the influence is reciprocal. Leader also likes to take advice from such members. They do extra things for the leader, and leader also does extra thing for the member. So here we say the result is a high quality relationship, that is +3. So 1 + 1 is not 2, it is becoming 1 + 1 is equal to 3. So the leader member relationship, it is high and low. Now in group, the members who are inside the green circle, they can be called as in-group members. And members who are outside the green circle, they can be called as out-group members. So we can divide the members in an organization into these two types. Relationships from the out-group members, they are less compatible with the leader. They come to work, they do their job and go home. They perform only to the specification of the job, and they won't go beyond to help leader or the group. So the relationship is stranger relationship, or we can say it zero relationship. The quality of in-group and out-group members is clearly different. Leader vis-a-vis follower A, follower B, follower C. In group, the quality is very high. Effect of quality LMX. Positive quality LMX gives good results for leader also. It is good for leader, follower, group and organization. It has been found that if a leader has quality LMX with all his members, even his health, physical health as well as mental health is also good. Even the mental health and physical health of the followers who are in group, in organization, they are much more better. Effects of quality LMX on member. Members have positive performance result. They get faster career growth, higher promotions. They have more organizational commitment. They have more ownership of the organization, or any project they take in the organization, they own it. And because they own it, after the success of that project, they get more pleasure and more satisfaction. They have better attitudes, desirable work assignment they get, because they can negotiate with the leader. And if they are not interested in any work, they can always say, sir, I don't want this work, I am interested more in this work. And they get more attention and support from the leader also, because leader also knows that if any work he takes, he will do it very nicely. They get greater participation and they are more creative. And creativity of each and every member of the organization contributes to the creativity and progress of the organization. Effect of LMX on the organization. How organization is benefited? There is less turnover. In industries, turnover is a big problem. They don't want people to resign immediately after 6 months or 1 year because training takes a lot of efforts and resources. Then there is clear role clarity if LMX is good. Because if any doubt is there in the mind of the member, he goes to the boss, he goes to the leader and clarifies. An out-group member would not clarify it. The clarity will not be there. Employee citizenship behavior, that is very important in industries, because I have been working in ordnance factories since many years, and I was consultant there and for ordnance factories group throughout practically my career, and then compensates being less empowered. This is very important. The many people in the organization are low skilled. They are class 4 or class 3 level, like peon or watchmans. But if the leader has very nice relationship with them, they still feel very happy to be in that organization. They feel empowered. I can just give the example of the hug given by the Munna Bhai, Dr. Munna Bhai in that movie to that Safai Wala. That feeling has to be there in the organization. Even the Safai Wala has to be respected and loved by the leader. Then only the organization will progress and organization will reach its height. Because the cleanliness, the Safai Wala is very important part of the organization, but they are mostly neglected and looked down upon. So that all leaders have to take care of. And when there is good LMX, these compensates them being less empowered. Then task performance also improves. Then members have a lot of trust on the leader if leader has good relationship on them. Now it has been found with the changing time, the electronic communication like this WhatsApp and email and other thing, even that can be used to increase our LMX. So electronic communication is also equally good now. Applications of LMX. Now, what is it is a prescriptive theory, a prescriptive model. Just like we doctors advise or prescribe to our patient. Now, to develop high quality exchanges with all members of the organization. Don't leave anybody. Develop good relationship with each and every member of the organization. The initiative has to be taken by leader, and leader has to develop all relationship with everybody. It does not matter if suppose someone is not taking the initiative, like sir gave an example that there is a critic and who is not he's saying something negative about us, and then the news comes to the boss and the leader, So he should approach him and he should give him some important work. Some important work has to be allotted to him. And then that after the completion of that work, that person has to be appreciated publicly, has to be felicitated publicly, so that he will slowly become an in-group member. And once he becomes an in-group member, it becomes very easy for all of the people. Make all followers feel in-group, avoid negatives in an out-group, promote partnership with all the followers. Like in organizations, there are sometimes people try to differentiate between some caste communities, some religion, and then their dialect and other things. So all these things the leader has to avoid. Now there are 3 phases of relationship development. These phases are similar to our human relationship phases. Like we meet a person sometime, someday, then we are strangers, then regularly we meet each other, then slowly we inquire about each other, and then we become friend, then we are just friend, and then slowly we become close friend, like that. So initially the first stage is stranger phase, second phase is acquaintance, and third phase is mature partnership. Anu? Yeah. Next. Yeah. So in the stranger phase is just like the out-group relationship. Lower quality exchanges are there, and they comply only to the formal leader. And the followers influence proactive in LMS development. If follower takes up the responsibility, then only he will progress. If he is not taking any initiative for that, or he is not responding properly to the initiatives of the leader, then he will not progress in that. Based on the effort, leader recognizes them as take charge followers. Small works are allotted to the member initially, and then if he completes that work, he is recognized as a take charge follower, and then slowly bigger responsibilities are given to the member. So the advice to young members or young psychiatrists in our IPS, start taking small responsibilities in your local branch, in zone and other things, even in IMAs. And then once you take up the smaller responsibilities, automatically you will get bigger responsibilities and you will rise in the hierarchy of leadership. I have seen people directly coming and asking me, sir, मुझे president बना दो, फिर मैं काम करूंगा. So that is not the good policy. Directly you should not aim to become president. You should first become a volunteer and then become. Slowly people will ask you to, and they will invite you to come in the executive committee, and that should be the philosophy. Like sir told us, don't hurry. It is a long journey. Leadership is a infinite process. Leadership is not a one match game like football or hockey. It is not a 1.5 hour game. It is an infinite thing. Leadership is a continuous thing. If one target is completed, immediately you get the next target, and the next target is completed, immediately the third target is there. So it is an infinite game. Acquaintance phase, it begins with an offer by the leader. As the acquaintance phase comes, leader recognizes that person as a good volunteer, and then he gives little bigger offer. Then it is a testing time for the follower as well as the leader. When the leader allots you some responsibility, maybe say for a small project, or say sports activity project, or some exhibition, or some little conference is asking you to arrange, that is the testing time for the volunteer. And during that time, the leader is testing you, and diet shift from relating, and if it is successful, the diet shift in favorably, and then LMX improves, and slowly even the member who was earlier only interested in self, his fees, his OPD and other thing, then starts thinking about the group and the organization. The third stage is the mature partnership phase. Here, the quality of LMX is very high, and mutual trust is very good. Respect, the leader respect the follower, and follower respect the leader. They have obligations toward each other, like health obligation, financial obligation, some family matter arises, the boss, the leader comes into the play, he uses his all the influences to help the member, and it depends on each other for favors and special assistance. Followers to do extra assignment and rely on leader support, encouragement, and information. They have already tested their relationship and found it dependable. That is a good thing about them. So these relationships go on for 10 years, 20 years, even after the retirement, this relationship continues. Till death, this relationship continues. So this is very important. This mature partnership, one established during working time or during employment or during profession, it continues till end. Relations are more egalitarian, or you can say equal, and it is evenly balanced. Though the leader may be very rich or very powerful and the follower may be poor, but still their friendship and their respect for each other is very high. LMX, what do we look for? Now people ask which followers are liked by the leader. The leaders look for followers who are enthusiastic. The follower should be enthusiastic to be noted by the leader. They have to participate. Their participation is very important. Unless they participate in the activities, leader won't notice them. Then they should be gregarious. Gregariousness is an extraversion. Followers look for leaders who are what followers look. Which type of leaders are liked by the followers? The leader should be pleasant. Leader should be trusting. He should be trustable. Like once he commits or agrees to something, he should give that service to the follower. He should not bluff कि मैं ऐसा ये करूंगा वो करूंगा और and then later he should not turn his sentences. Like he should be cooperative and he should be agreeable. That is very important points to be noted to become a good leader. Few important observations after research has been made that leaders' extraversion does not influence relationship. Many people believe that the leader should be more extroverted. It is not compulsory. Even a normal or introvert person can also be a very good leader and can be accepted as very nice leader. Then followers' agreeableness does not influence leader. Many followers, they have a wrong notion that if they agree to each and everything of the leader, they will be liked by the leader. But leaders are always smarter than the followers. They recognize that this agreeableness is not genuine. It may be, they can identify, leaders can identify flattery. Leaders can identify that this person is not actually willing, but he is just agreeing to in front of me. So that agreeing to each and everything of the leader should not be resorted. If you don't agree to this, you can always assert, you can always say humbly, sir, I don't agree to this, like that. Then the main predictor of LMX relationship is the performance of leader as well as the follower. If you don't perform well, both leader as well as follower, the people won't like to make a lot of relationship with you. The performance has to be very high. You have to do hard work, and there is no substitute for hard work, perseverance, and patience. Now, a bigger part of this is emotional entrenchment, but I am not keeping this for today's talk. That is a big topic, and mostly it involves a lot of emotional intelligence and emotions, and a lot of psychiatry and brain neurochemistry is also involved there. But only I am touching that thing that there are stages like this: strangers, acquaintance, and partnership stages. Like there are stages in emotional development also. So that that topic some other day we will take. And
Sir,
here the
I think,
important concept.
hello, Deepak sir.
Yeah.
I think other topics we can cover. We'll take webinars next time.
Yeah.
I think.
So this topic I am ending here. This mutual emotional entrainment itself is a big topic. It is a big topic, quite easy to understand for a psychiatrist. So I am stopping here. Now advantages: it is good, intuitive, focusing on dyadic relationship, good communication, trust, and respect. And this LMX theory promotes diversity, equity, and inclusion. DEI we call in industry. DEI is very important in industry because unnecessary things happen if you neglect all these things. Then it is proven to be cross-cultural model, and strong research evidence is there for this theory. Though for Indian people or our village people, it looks very normal, very usual, and people say, "अरे इसमें तो कुछ है ही नहीं नया." But with modernity and modernism and the dominance of individualism and capitalism, these things we are losing, and then we have to again capture that field which already our Indian culture had. Thank you very much for patient listening. And Dr. Shiv Gautam sir's talk was wonderful. It is always inspiring. I had listened to his talk during a youth conference in Aurangabad in I think 1918. Manasvi had organized that, I think, and I remembered that, and then I thought first name came in my mind that sir should be called for this conference. Oh, so nice of you, sir, for coming here and obliging us. Thank you so much.
Sir, may I request you, thank you so much for this wonderful theory. May I request you to stop the screen share, sir, so that we can go ahead with the Q&A very quickly. I know we have overshot time, but I'll just ask 2 questions to Gautam, sir, that came from the audience. Sir, almost everybody equally has said that your confidence is truly inspiring, and listening to you has been very, very inspirational. Dr. Rahul Garge wanted to know, how do you prioritize your well-being and manage stress to stay energized and focused? Because he said that your energy is very evident from your demeanor.
Well, I feel that my energy comes out of faces like you. I talk to young people. I feel young. I am 73 completed today and entering 74 tomorrow on Mahashivratri.
So very happy birthday to you from all of us.
Happy birthday, sir.
Happy birthday, sir.
Yes, yes. Thank you. And the energy comes from seeing smiles like what I'm seeing here from Dr. Rathore. You know, I have gained energy out of my things. COVID. I was in medical emergency ICU for 51 days. And I was on oxygen for 6 months. And during that period also, I never felt that I'm sick. I was continuously reading 2 Vedas, Atharva Ved and Rig Ved, and I was reading Bhagavad Gita for the 6th time. I was writing every day my COVID diary in the ICU also, except the 2 days. And I never allowed myself to think about the illness. So see, you have to draw energy from in adverse circumstances also. From whatever you, that I got a diary and I was writing every day. Second source of energy is journaling. Every day you must sit for half an hour, write your emotions, write your feelings, write down what you feel for the day and what are your priorities for the day. Those things which are higher in priority, they should be done first. And those things which are lower in priority, they should be done next. Sometimes you do things which are not in your priority and you feel unhappy at the end of the day. So prioritizing your day, prioritizing your near future, and prioritizing things in your personal relationships in your family, it is all very important. Next Saturday, I'm talking to the doctors of National Medicos Organization in a conference. And the topic which I have taken for that is balancing academics, practice of medicine, and personal life for a successful profession. See, a balance between the three, your academics, your practice, and your personal life, this balance is very important, and you have to prioritize that. Well, the time is very short. How to prioritize it is a comparatively longer topic, but still, I am not becoming older tomorrow. I am becoming a year younger. Thank you very much. Thank you very much for the comment, which is coming here. So I think that is what is very important. I work for 7 hours a day for my clinical practice now. 2 hours a day in the morning, I walk about 5,000 to 6,000 steps every day. And I give water to my plants. I have about 150 plants on my terrace, which I have grown myself. And each flower bud which is coming every day, it makes me feel very good. And each plant which is become greener, it gives me energy. So that is one thing which I do every day morning. And I don't practice after 7 p.m. in the evening. I eat only once a day, that is in the evening, which I will do it now. And I take only fruit in the morning in my breakfast and 2 cups of liquid throughout the day. And then, of course, lot of water. So you have to prioritize what you have to do, what you have to eat, what you do, what makes you feel comfortable. Most important is your personal comfort, which you have to have in your life. So be comfortable, be happy, and do what makes you feel happy.
Thank you so much, sir. Such a good message on your birthday for all of us. Because of the paucity of time, I will not be able to take any more questions. May I now request Dr. Nagecha sir as the chairperson to give his comments so that we can close the program after his.
Well, before that, I thank you very much for inviting me.
Yes, sir.
Thank you,
of
sir.
course.
Our pleasure, sir. Our pleasure. Our
Thank
pleasure.
Thank you.
Vijay
आपने
sir,
हमारा
your
मान बढ़ा
videos
दिया
off.
था.
Yeah. So we have learned from Dr. Shiv Gautam that how to become a good leader and how to prioritize our things so that we can become a successful leader and successful practitioner, balancing life, and what time should we spend on our practice, on our prioritize our health, and making a relationship with our colleague. We prioritize outer group, inner group, which we have learned from the Dr. Deepak, and it was really good learning from both the speaker. I thank you both the speaker for saying. Thank you everybody for patient listening and giving active participation in the webinar. Thank you all.
Yes.
Thank you all. Thank you all participant. And now we can close the session. Yeah.
Thank you very much. Good day. Good
Vote
night.
of
Amar
thanks,
sir
Amar?
wanted to. Yes, sir.
Amar?
Amar sir was, yeah.
Yes, sir. Thank you everyone. Thank you, Gautam sir. It was insightful presentation. Thank you, Nagecha sir, for sharing the session. And thank you, Deepak Rathod sir. You are having excellent experience in leadership. And all the participant and Dr. Abha, wonderful program. And it is a great start for this year leadership committee. Thank you all. Good night.
Good
Good
night.
night. Good night.
Bye.